Good afternoon and welcome to our NursEduPal IMPACT dissemination webinar. Today, the webinar is entitled Let's Influence, Educational Resources to Promote Knowledge and Leadership in Palliative Care. And we have members of the NursEduPal team here presenting. So my name is Patricia White and I work at the EAPC and also delighted to be working on the NursEduPal IMPACT project. I'm also joined by Dre from EAPC and Guillermo, our in-house technical expert. So we're delighted that all of you have joined us here today. And as you may know, with webinars, it will be recorded and it will start very soon. We're just waiting for the last few people to enter. For your information, once the presentation starts, you can increase the size of the slides and you can translate them into different languages. And as I said, the webinar is being recorded. And this means that it will be available for you to watch and it will be on our website within 2 weeks of this webinar. As an attendee, you're not on video, so we can't see you and we can't hear you, but we really want to know that you're present. And we'd like you to be engaging with us and throughout the presentation. So just to ensure that you can find where the chat button is and that we are properly linked together, if you want to just write into the chat where you're joining us from today. And I can see already that some of you have successfully found the chat button and that we have people from all over Europe and beyond. So you're very welcome. A certificate of attendance is available for anyone who joins us here. And towards the end of the webinar, I'll give you a link to the page where you can complete the webinar and also an evaluation form. So all that's left for me to say is to enjoy the webinar, and I'll hand you over to our chair, Mina Hooker.
Thank you very much, Patricia. And I want to wish you all very warmly welcome. It is a great pleasure to be in this place now. We are heading to the end of the project, and we have already a lot of things to disseminate for you and tell about what we have done during this 2.5 years, I think already, a little bit over already. So I am the coordinator of the Finnish part of the project and with my dear team member. And now I want to introduce Patricia, who you already heard a bit from EAPC, and she will tell a little bit about our educational resources. So the floor is back yours, Patricia.
Thanks, Mina. Yep, it's me again. And I just want to give you a quick overview of the project. I think as many of you know, the NursEduPal at Impact project has grown kind of organically from the previous NursEduPal Euro project. And this developed innovative learning tools to enable nurses involved in education to have engaging education for those in palliative care. But it was very clear that what was important is that those learning tools and those now can have an impact, and that the nurses using those learning tools can influence the quality of palliative care that's delivered. So the NursEduPal IMPACT project, we want to make an impact, and we want to develop nurses not only to have the knowledge, but also to have the skills and the sense of leadership to influence others in palliative care. And this is, I suppose, best described through our learning trajectory. And this is really also a summary of the whole project. You can see it's a set of concentric circles. And at the very heart of the circle is the individual, is a person building their knowledge. And as they build that knowledge, they gain more experience, their self-efficacy improves, and they can become an influencer or a leader in palliative care. Within each of these different dimensions of knowledge, self-efficacy, and influencing, we have discussed leadership under 3 different dimensions: professional leadership, clinical leadership, and moral ethical leadership. So the objective is to empower nurses and their educators to show that leadership can influence palliative care, and to develop these palliative care influencers that can promote good practice in their clinical surroundings. Going back to this learning trajectory, at the beginning we have knowledge, and it was very important that we build a body of knowledge in professional, clinical, and moral ethical leadership. And we've done that through webinars, through course manuals, and through e-courses. But we've also developed ways that nurses can use tools, that they can have an impact. And that's through the development of innovative tools, but also by bringing nurses together in communities of practice. So we have run several impact weeks where nurses come together and can feel more empowered and have better and feel that they are skilled to use the tools and to impart the knowledge that they've gained. And finally, all of this comes together really in a package, in a manual or a program, a Let's Influence program, where nurses can have the knowledge and the skills and the sense of self-efficacy to become influencers in palliative care. Just to give you an idea of where we are at the moment, we've already developed 16 teaching webinars, and they're available on our website. We have 18 syllabi and e-courses, and these are in 4 different languages: in English, Flemish, Finnish, and Romanian. And in the webinar, syllabi, and e-courses, you will find similar content, but it's presented in different ways. As we know, people have different learning styles. And we invite you to go to our website where you can find these resources and find one that works for you and for your learning style and also your students' learning style. We've had impact weeks in 3 countries, and to date we've had 61 participants in those impact weeks. So you can see how our model is growing and how we are developing the NursEduPal at Impact project. First of all, I'm going to hand you over to Camilla, who will talk about some of the resources that have been developed. I'll just mention that these ones that we have are available on our website. These all have come from stories that have been submitted, and these are resources in relation, as you can see, to skills labs, to clinical reasoning, to moral debate. And all of these materials are available on our website. They're freely downloadable. You don't need to register, and also they're adjustable to a format that suits you. And with that, I'll hand you over to Camilla, who will talk about the resources specifically that we have in relation to professional leadership. Thanks.
Thank you, Patricia. Hello, everyone, and a very warm welcome to all of you joining us today. I will present further the resources that we develop in NursEduPal at Impact project in professional leadership. It's important to understand that if you use and integrate these resources, help you to somehow to shift the perception of nursing from a supportive role to a lead driving force in patient-centered care. And also can help us to improve the knowledge in professional leadership, to empower nurses to implement leadership competencies in palliative care, and to provide the basic knowledge in professional leadership that is required to proceed to the next level in our professional trajectory. For professional leadership, in this project was developed 14 modules. 6 of them are available both as course manual and e-courses, and the rest of them are available just as a course manual. The leadership topics were divided into leadership foundation and organizational change, module 1 to module 4. These modules establish the strategic framework in nursing leadership, but because the session about leadership in nursing help us to define the role of the nurses, not just as a clinician, but as a leader within the healthcare system. Leadership practices help us to apply leadership theories in our daily clinical practice. Mentoring cultivate the culture of growth for by guiding less experienced staff from our team, and change management learn us how to lead our teams to institutional transitions. Also, we have modules from 5 to 9 in the communication and influence. And here we discuss, and you can find materials about presentation skills, both presenter and environment, because these are useful for us are necessary for us to deliver information in different situations. We have circle of influence, and the role of this module is to identify where a nurse can effect change and how to spend their professional reach, how to expand their professional reach. And then we have clinical communication, because we work a lot with patients and their family, and have to know how to conduct a family meeting, and also how to conduct an interdisciplinary team meeting. After that, from module 10 to module 13 are about interpersonal dynamics and team growth. These modules focus on motivation, because it's important to understand in our team what are the drivers for our team members' motivation. It's important to use tools that help us to resolve conflicts and to provide constructive feedback. It's about self-awareness, because it's important to understand our own weaknesses and strengths. And also a few materials about teamwork and team building. And the last module, it's about efficacy in time management and delegation, because learning the critical skills and how to prioritize different tasks is important to prevent burnout. As you can see in this slide, we have different tools. And in this presentation, I will present more about values exercise and Kotter 8-step change management, and a few things about mentoring step-by-step tools, but I will explain later. Next slide, please. In this slide, it's an image from e-courses about leadership practices. Here you can see the 5 practices: model the way, inspire the shared vision, challenge the process, enable others to act, and encourage the heart. For this session, for these modules, I think that more important exercise is about personal values. Next slide, please, Patricia. And we consider that it's important, because the first step in our leadership journey is inward, to discover personal value and belief. In this tool, participants receive a list of value. First, they have to choose 7 most important values for them. And the next step is to narrow down the 7 values to the 3 most important value. In this exercise, we teach participants to apply this list of value to the team members, and to find out what are the shared values in their team, and these values let them to guide in their activities. Next slide, please. Other tool is useful in change management. It's Kotter 8-step. This model is helpful for transition from a reactive care model to a proactive leadership-driven nursing approach. In this tool, participants receive a specific change management scenario from facilitator and an envelope with puzzle pieces. These puzzle pieces are different activities, different activities associated with each step. They must to match this action with each step from the model and to find out how they can deal with different changes in their settings. Next slide, please. Mentoring step by step is a tool that was developed for Let's Influence program. The aim of this program was to enable, empower, and to encourage nurses to demonstrate clinical, professional, and moral ethical leadership and to enhance their capacity to act as advocates for palliative care. This program has a theoretical component for participants and another one is a practical component. And for this practical part, participants are required to come in the project with an individual development plan. This means a small project, management project for development of palliative care in their organization. This individual development plan has few components as background, goals of this project, objective, activities, and timeline and resources that are needed for this project. And at the end of the program, they had to add the individual development plan the results and self-reflection about what leadership skills they developed as a leader in this project. Also, you can see here periodic progress report. They meet periodically with a mentor, which guide them to go further in this project because always exist some barriers and mentor help them to go further with this project. And I think that this is yes. So these are materials for professional leadership, and we encourage you to see them not just as a theory, but as a practical tool, which you can use to improve clinical practice and teamwork in palliative care. Thank you.
Okay, I thought Camelia was going to introduce me, but I'll just introduce myself. I am Dani Verreke. I am the project coordinator of the NursEduPal IMPACT project, and I'm here sitting very proudly of the efforts of the team for what they have achieved already. And we still have some time to go. The project ends at the end of November. So we still have a little bit of time to add extra resources to our project website. I will be telling you about the resources that were developed in clinical leadership. Next slide, please, Patricia. So you have seen our learning trajectory already. Together with the team, we've developed different knowledge topics. Next, Patricia. So you can see them listed here. So what do nurses need to know about the clinical aspects of palliative care? That's what we thought about. And so we came up with these topics. Of course, the basics of palliative care. People need to know what it's about, what is its focus. But it's also important to know how to recognize palliative care needs, and that are the palliative care indicators. And effective communication in all healthcare situations is important, so also in palliative care. So therefore, we have a module on ISBAR communication. And of course, palliative care can only work well if there is a good advanced care planning where people proactively thought about their current and future care well in advance for having a terminal illness. And then we have total discomfort as an extension of the concept of total pain to illustrate how the 4 dimensions of palliative care also impact each other in the experience of discomfort during a disease. We have a module on the most commonly occurring symptoms in palliative care and how to recognize them and how to deal with them. And then we have a description of the most common aspects of a dying person. What can you see happening, and some information on the relevance of facilitating final farewells. And finally, after a patient dies, palliative care doesn't stop. So there is a lot of loss and sense of bereavement, and our last module is dealing with that. So that is the knowledge part for clinical leadership. And then on the self-efficacy part, we have developed different impact tools in which you can put the knowledge that you gained in the inner circle into practice to improve your self-efficacy. And next one, please. Yes, next one. And for the Let's Influence program, so that's where the people that have done the knowledge circle and have done the impact week, they are mentored by us for 6 months. And during this 6 months, as Camilla just explained, they need to do a small improvement in the working setting that they are active in to improve visibility about palliative care or improve some palliative care practice or whatever. And in my case, I had 2 participants following the program. And one of them is not a nurse. She's actually an orthopedagogue, if this is the right word in English. And she's working in a facility for people with cognitive disabilities. And she strongly felt that although they are making efforts for a good ACP with those people, it could be improved. And she's now trying to make visual support to have ACP with the people that are living in her facility. And the second person is a nurse. He is working in residential care, and he feels that there is a lot of taboo and uncertainty on palliative sedation among everybody working in his facility. And so he wants to improve that, and for that he is developing an e-learning. Just to say that the people that are following the entire trajectory are making an impact in the work setting they're active in. So I would like to make our session a little bit interactive. It's always a little bit of a difficulty because we cannot talk to each other, but I hope you have discovered like the hands up tool already or the response tool. So these 2 things you will need together with the chat, because next one, please, Patricia. I would like to introduce you to the schemes. So 2 of the impact tools, the schemes and the palliative care indicators. Next one, please, Patricia. All right, the schemes. So the first scheme that we think is relevant in the context of clinical leadership in palliative care are the illness trajectories. And the illness, there are 3 ways in which you can die aside from sudden death. And this is an oncological trajectory, a trajectory of chronic organ failure, or a trajectory of frailty. And in all these 3 trajectories, palliative care is very important. to understand the position of your patient that you're taking care of, and the lifespan he might have, or what things are coming ahead of your patient, it is important to know on which trajectory you put your patient. And of course, combinations are possible in reality. And also to decide where on the timeline do you put your patient, more to the left where everything is still more or less going fine, or more to the right where your patient is deteriorating fast and is approaching death. So this is the first scheme. The second one is the From Cure to Care scheme. And the From Cure to Care scheme gives you an overview of the different phases that occur when a person has a disease that they cannot be cured from anymore. So as you all know, palliative care needs starts as from the diagnosis of such a disease. And although curative care is at that moment still very important, so they try to lengthen your life. As you move towards the right of the scheme, palliative care needs become more and more strong until you reach the end of life phase, where you will need specialized end of life care. And then when you pass away, palliative care refocuses to your close ones because they might require aftercare and bereavement care. And you can see that the dots under the purple section or the line under the purple section is dotted because, as you all know, you cannot put a time on loss and bereavement. The scheme From Cure to Care also shows that when you move from left to right, the palliative care needs of the patient increase until death. And then, of course, the palliative care needs of the close ones will become smaller with time. You also see that depending on where you put a person on this scheme, you will have different goals of care that are related to the care needs of the patient, and those change in function of time. At the beginning, everything is done, you are then everything is done to lengthen your life. But as you move to the right, everything will be done to keep you as functional as possible, trying to keep the quality of life as high as possible, and that's early palliative care. And then when you move further to the right, comfort care will become very important, and advanced symptom control. And at the end of life, you will have maximum comfort to give you an as comfortable death as possible. So these are the two schemes that we use, and we think they can be used to assess the situation of your patient, but they can also be used as a communication tool. Okay, so this is the theory about the two schemes. So let's try it now. So I will read to you the case of John, a very short case. And the idea is that you listen carefully and you try to assess where you will put John in the two schemes that we've just discussed. All right. So John is a 66-year-old retired school headmaster who lives with his wife in a spacious flat by the sea. He is a devoted husband, father of 2 sons, and a proud grandfather of 5. Early last year, a lump was discovered in his lower leg. What first seemed harmless later turned out to be a liposarcoma. John undergoes chemotherapy and radiotherapy, but his condition deteriorates during treatment. Eventually, complications lead to the amputation of his lower leg. Despite the setback, John shows resilience and continues to engage with family and friends. However, by the end of the year, John's health declines rapidly. He develops neurological symptoms and scans reveal a brain tumor. After radiotherapy, his condition worsens further with severe weight loss and increasing weakness. All right, so next one, please, Patricia. So when we look at the illness trajectories, and please write in the chat, where do you think we should put John on which of the trajectories and at which position in the timeline? So more to the left or more to the right or in the middle? So I'll just give you a few minutes to take a look and decide. Follow in the chat. I see oncological to the right, but somebody else thinks he should be on the left. And then another person thinks quite far to the right. All right, so we need to come to a consensus here. So Patricia is putting the dot on the oncological line, more people on the left. So if you agree where the dot should be, just put a thumbs up with the response button that you have there on top of the screen. This is the right position, do you think? Okay, we have some thumbs up. Okay, so let's remember where we put the dot. Okay, next slide, please. Okay, and then now the from cure to care scheme, where do we put John? Again, you say curative, chronic, or palliative, then or end of life, then we have the colors. And then again, you will tell if it's higher up or lower down, because if you put a vertical line through a trajectory, you can see which types of care a person will require at that position. So we put curative, chronic, palliative, or end of life, and then up or down. And then Patricia will just look in the chat and then have the dot going where you are saying it should be. Aftercare, John is still alive, and so I think we're not there yet. Palliative, palliative, up. Okay, other people have ideas. Again, if we think that the dot is on the right place, put a thumbs up, or some other thing if you don't agree. So do you think that this is the right position for John? Okay, yes, we have a thumbs up. All right, and then the next one, please. Okay, so now, Patricia, you remember where we put John on the illness trajectories? Yep. And where we put him on the cure care? Yes. So we were close, but not completely at the same place. So the idea is that by using these two schemes, you position a patient normally at the same position with both tools. If this is not the case, that's of course not a disaster, but it means that maybe you should kind of reconsider where you think John, in this case, is on both trajectories, but because putting him on a certain position in a trajectory coincides with certain care goals and with certain care needs. And you can use this tool to discuss particular patients with your team. And this could reveal potentially different perspectives on how people look at the situation of a patient. And if you have people in the same team having different perspectives on the situation of your patient, this can lead to inconsistent care. And so if you use those tools, you can kind of put everybody in the same focus and put the care, the goals of care and the care needs aligned. You can also use this as a communication tool with other healthcare providers, but even with close ones, because they tend to have maybe two positive views on their loved ones who is ill. Okay, so these are the schemes. Let's move to the next impact tool, the palliative care indicators. Next one, please. So the palliative care indicators were developed because it was noticed that signs for palliative care needs were not recognized, and therefore palliative care is started or initiated way too late in the disease trajectory of people, often in the last couple of days of life. So that's not like timely palliative care, but that is end-of-life care. And that's, of course, not sufficient to give people the quality of life that they can have, even with a serious illness. So I will not read the indicators. You can see them for yourselves there. And you can see that these are signs that are easily recognizable by everybody, also by laymen, so also by close ones, by people that are ill themselves, by patients themselves, and of course by healthcare providers. So the importance is that when you notice some of these indicators in a patient, that you should assess what is going on and act upon it. I will not go into the tools that further go into this acting. It's a surprise question, the SPICT. But most important is to talk about it. When you see those signs, talk about it, report them, act upon it, and actions could be that the goals of care are reevaluated, that the care is adjusted, or that advanced care planning is started, or at least a next conversation is planned. So let's take John again, and let's play the palliative care bingo. Yes, Patricia? Oh, yay! one push too fast. Okay, I will read John again. And you will need to listen carefully. When you see two indicators, you put your hand up with this reaction thing, and I hope my colleagues will be able to see you because I cannot see you. You put your hand up, and the first person who puts his hand up gets to say which indicators he or she has spotted in the case of John. So everybody ready? It's a little bit a complicated thing, but let's hope that it works. Okay, I see Garish has already heard something, but I haven't even started rereading the case of John. So hold your horses, we are almost there. Okay, there we go. Ready? It's the fastest one wins. So early last year, a lump is discovered in John's lower leg. What first seems harmless later turns out to be a liposarcoma. John undergoes chemotherapy and radiotherapy, but his condition deteriorates during treatment. Eventually, complications lead to the amputation of his lower leg. Despite this, John shows resilience and continues to engage with family and friends. Nobody? Okay. By the end of the year, John's health...
We have a winner.
Okay. Okay, Janneke. Was Janneke first, Mina?
Yes.
Okay.
Yes.
So, Janneke, please put in the chat the indicators that you heard. Oh, I have already some. Janneke has, wait, let me see. Yeah.
So she has written in new severe pathology.
Yes, that's one. And what was the second?
Also, we have pathology as well from someone else. Yes?
Yeah. Okay. Any change, indeed. Yes. So now you can put up the next one, Patricia.
Yeah.
So indeed, already in the first sentence, that you can push. Yes, voila. We already had in the first sentence the lump, which is already suspicious and might indicate the change in the condition of John. And then just few words later, we already heard liposarcoma, which was a new severe pathology. And then later in the case of John, there is the brain tumor, the metastasis in the hip. That is another part on the case. We had the weight loss. And we had the change in care needs because his health is deteriorating fast. He had an amputation of his leg and he becomes increasingly dependent. So the indicators, you don't need to use it as a bingo, but I think it always adds a little bit of animal to any kind of training that you are giving. But in Belgium, at least, these indicators are now widely used also in the discussion about patients' situations. Because very often it is very small differences, but if many of these differences occur at the same time, you need to assess what is going on and you need to act. And with that, I am happy to pass the word on to Mina-Lisa, who will tell you about the resources developed for moral ethical leadership.
Thank you, Dani, and thank you all for being here in our webinar. Now we can take a peek of the moral ethical leadership resources and also try some tools like you did at Dani's presentation. You can find all of the knowledge materials of the moral ethical leadership in our project website, and our Finnish team from Diakonia University of Applied Sciences has also included docent Arja Suikkala and Dr. Leena Segler-Heikkilä, who have been building the knowledge part of our project. But as we mentioned, it is important to provide materials in many formats, so we want to give the learners the power to choose. So we have the previous webinars, e-courses and the syllabus. But now I give the floor to Minna to present our project materials in more detail, and we can change the slide.
Thank you very much. So I was Minna. I started in the beginning, so you all know me already. And I will tell a little bit what we have done in this part of the project. So if you click once. Thank you. So we were building knowledge to the our part, and we were focusing on moral ethical leadership. And we have built the syllabus and about ethics in palliative care, where we introduce ethics in general and how ethics is essential in palliative care. And also we have put effort on communication ethics in the second topic. And this is more or less a general introduction. And the next one, the number 3, puts more focus on the ethical standards, the real thing, how you should communicate and what makes communicating ethical. And also we have our last part about ethical reasoning and communication. And as also the other team members, we have developed the self-efficacy tools. So we do have an escape game, which is an evening shift on the palliative care ward. And during this webinar, you will get a little bit of peek of that. And we also have a tool about active listening in advanced care planning, conversation, and also one tool about ethical reasoning, which is an Eric's case. And we also have the same Let's Influence program, which is developed by our Romanian team. And this is some of the things. We have quite a lot of students. We didn't want to say to them that you are not allowed to be with us anymore. So I think we have almost 20 students, and they are doing their impact things as pairs. So it is nice to see that also in Finland they recognized the need for advanced care planning for people with disabilities. So they are also developing a visual way to have this conversation, even though they have not been communicating and we have not been communicating with Danny et al. So this is very nice to see that maybe this is one thing we would need to work on more broadly. And also we do have a lot of nurses from the hospital at home, and they have developed a pre-assessment advanced care planning form to help the work for them, and also for the collaboration with the hospital at home and the acute emergency services. So a collaboration tool to help with this collaboration and communication. And also they developed orientation materials for new home hospital nurses when they come to their new work. So how to take that part of the care on their plate. And also they develop educational material for colleagues, patients and family members on, for example, palliative care, medication infusions, end-of-life care, bereavement, spiritual and psychosocial support. And then they have developed a care planning meeting form for a geriatric unit, and also they have implementation of the ESAS measurement as a systematic tool in an acute unit. And if you click once, this is with the red, you see the escape game. So we have had the pleasure to have Minna-Liisa on board. She is a PhD researcher, and we will get really research results also about the things we have done. And the escape game is one part of her research. So I'm very proud to hand the floor back to Minna-Liisa.
Thank you, Minna. And we can change, yes. I'm really excited to introduce the game to you today, and maybe you can utilize it more later. But this is our tool that we developed through this project, and also to my PhD studies. So I give you some context. The cases in this game reflect the moral ethical dilemmas that are based in real life stories. So we have collected in this project 245 nurses gave their reflection on the moral ethical dilemmas they encounter at their work. So maybe there are some nurses here as well today, so we are really grateful. And now you can see that some of the cases, or maybe many of these, are now representative in this game, and also in the other tools as well. But why we chose a game? It's because we believe that self-efficacy is the key to the personal growth of nurses. And self-efficacy means having a confidence to act in a situation. It develops from knowledge, experience, feedback, and seeing others to succeed. So as a game, we think that we can use the knowledge to support each other and find the courage to act together. So, and it's also a really safe place to practice. And it can help participants move from hesitation to action. Maybe I don't know, the feeling of the game and feeling of something. We have to be fast and we have to work together, collaborate. But yes, the game is set during an evening shift on palliative care ward. The full session of the game lasts approximately 3 hours. It includes introduction, the game itself, and the debriefing to reflect the experience. And you can look at the maybe last, yes, still more things to say on this, because I want to point out the photos of these slides. So at the first picture, you can see that there is a team really focused on solving problem together. And on the second picture, you can see maybe the most important part of the game, the debriefing after the game. But now this is enough for the background. We can move on, and it's time for you to experience a little part of this game, and it's really modified to this event, because as you saw that the game is like a board game, and now we have this kind of webinar, so I have had to make some changes to it, but I also wanted to show you that you can do it, and it's all for you to utilize and use how you want. But now you can hear, you can see that we start from this kind of scenarios. Look at these 3 different that you see on the screen. A patient with a painful, dry mouth, family fearing that pain medication will hasten the death, and mother, Laura, who hasn't told her children she's dying. Here are some quick answers already. I give you a short time to answer. Type your ideas in the chat, like 1 is AB, 2 is BC, etc. Yeah, there is all. That's good. 1A, yes, nurse, we need a nurse, psychologist. ABC, Andreas says that, nurse, doctor, social worker, chaplain, Jannike is saying. Really good. Shani is saying PC doctor. Really good. We need maybe doctor in all cases. ABCD. Yeah, really good ideas, really fantastic ideas at the chat. And as you can see, every scenario needs a different mix of professional or all of the professionals. Sarah is saying perhaps B, A, nurse we need, perhaps a doctor. Yes. A healthcare assistant also. Yes, that's good. Really nice answers. Thank you. But this game that we now played, the most important part is the debriefing, which we can do after this. We don't do it now, but we can do it when we are with our students or other colleagues. And then the debriefing is the real place where the learning is happening. And in this, we use the structured method called PEARLS to talk about the experience. But sometimes we face moral ethical dilemmas because of the systemic problems, and these can be lack of resources of staff, gaps in our own knowledge, or guidelines that do not match the values of palliative care. So this debriefing can give us a space to talk about the gaps between what we want to do and what we actually can do. And at the debriefing, we can ask at this part of the game, do we actually have these experts available in our ward? Where are the limits of our own skills? And how should we act when the situations feels difficult or impossible? So the game can be a start of the debriefing and help us to find the ways to survive and grow in our daily work. But thank you for all of your comments, and now we can move to the next game. Now I want you to rearrange the conversation that you can see. You can put the conversation in the correct order, and then you have to find the highlighted letters in each sentences. And there you will find a word and type the word in the chat as soon as you find it. I will give you a time to first read everything and then see if you can find the highlighted letters and find the word. Yay! Geraldine and Jannike and Dr. Shani. Really nice care. Yeah. That was, Jannike was almost winning the second, but really nice. Thank you. So the word is care. Great job. But this is like, we can, in the debriefing, we can dive much more deeper in this dilemma. We could ask, have you faced this kind of situation where there is some things that are like really difficult conversations with the children, when the parents are asking, should we tell, what should we tell, how should we tell, shouldn't we tell, and everything like that. Do you recognize these problems, and how have you handled these in your real life real work? And yeah, we can go to the last slide. But this was our presentation of the short presentation of the game. And I want to emphasize that these materials are not set in the stone. So in fact, we really encourage you to adapt them. And whether it's the game or other tools that our project have provided. So feel free to pick the parts that work for your needs and change them if you like. But I want to thank you, and now Minna can take over.
Thank you very much, Minna-Liisa, and the whole team. Great to see how much we have already achieved. And as you said, Danny, we still have a couple of months, so let's see what we figure out with this couple of months. And if you want to share comments or give us questions, just write down in the chat. And there were some comments. Thank you to all the presenters for the, oh yeah, it was just Dewey who put that you can send questions. I saw in the chat that there were already like networking ongoing in the chat, which is also very nice. We always encourage everyone to do networking. But during the webinar, I didn't really see questions for us. So now you do have the possibility to ask. So please ask if you want to know something more. No questions. So maybe then move forward, and I will just invite everyone very warmly to Prague and to our pre-congress. We do have our pre-congress event there, and we will be there, all our team members, and we will really then take with us paper and scissors and everything so that we can really test what we have done. And you are very warmly welcome to test the games and be with us in Prague. And here is our team. And then second picture of our team with emails, so you can find us if you want to have more information of anything. And then we will also have, as Patricia said in the beginning, we have the possibility to share you a certificate and attendance. So you see the QR code here. Just go there and provide us the needed information, which you will find behind the QR code. And then you will get a certificate. And we are also very, very grateful if you will take a little bit of time and complete an evaluation form. When you are doing your certificate, you are providing us at the same time the evaluation. So it's very important for us when we are trying to develop and grow ourselves, and the best way for that is to get evaluations and feedback from you. So I want to thank and ask my team members, is there still something which needs to be said, or are we going to close this dissemination webinar? Yeah, nodding. So thank you very much, and hopefully we will meet with a lot of you in Prague. Just come and visit us. We will also have a stand there. I don't remember the time. Of course, we could have also put that on the PowerPoint, but we will have a table there for 45 minutes or 1 hour time. And please come and visit us. And if you see us, just grab our jacket and say hi. We are there for you. Thank you very much for everyone. Bye-bye.